Have you ever wondered what's really going on inside someone's head when they talk about anxiety, depression, or OCD? It's more than just feeling sad or a little worried. Today, we're going to gently peel back the layers on some common mental health conditions, not with jargon, but with real-world understanding. This isn't about labels. It's about empathy. Let's start with anxiety disorders. Imagine your body's natural alarm system. The one that tells you to jump out of the way of a speeding car is stuck in the on position. That's what it can feel like. For someone with generalized anxiety disorder, this could be a constant, nagging worry about everything and nothing all at once. Health, work, family. Even when things are going well. Then there's panic disorder, where that alarm suddenly blares at full volume for no apparent reason, causing intense physical symptoms like a racing heart and shortness of breath. It's terrifying because it feels like a medical emergency. And with social anxiety, the fear is centered on judgment from others, making everyday interactions feel like a high-stakes performance. Next, let's talk about mood disorders, like depression. It's not just the blues. Major depressive disorder is like seeing the world through a gray filter. Things you used to love lose their color and joy. It's a heavy, persistent emptiness that can drain your energy, disrupt your sleep, and make it feel impossible to just get out of bed. On the other end of the spectrum is bipolar disorder. This involves extreme shifts in mood, from the lows of depression to highs called mania or hypomania. A manic episode isn't just being in a good mood. It's a period of intense energy, racing thoughts, and often risky behavior, which can be just as disruptive and damaging as the depressive episodes. Now, let's touch on obsessive-compulsive disorder, or OCD. This is one of the most misunderstood conditions. It's not about being super neat. OCD has two parts. The obsessions are unwanted, intrusive, and distressing thoughts or images that you can't get out of your head. To try and relieve the intense anxiety these obsessions cause, a person performs compulsions, which are repetitive behaviors or mental acts. For example, an obsession about contamination might lead to a compulsion of washing hands until they're raw. The person knows it's irrational, but they feel powerless to stop. Finally, there's post-traumatic stress disorder, or PTSD. This can develop after experiencing or witnessing a terrifying event. It's like the brain gets stuck in danger mode. The person might relive the trauma through flashbacks or nightmares, actively avoid anything that reminds them of it, and feel constantly on edge. It's the mind's way of trying to protect itself, but it ends up trapping the person in the past. Understanding these conditions is the first step toward compassion. Mental disorders are not character flaws or signs of weakness. They are legitimate health issues. If anything we've talked about sounds familiar, either for you or someone you know, please remember that help is available and recovery is possible. Talking to a doctor or a mental health professional is a sign of incredible strength. Thank you so much for joining me to learn and grow today. If this video helped you understand a little more, please give it a thumbs up and subscribe for more content that matters. Take care of yourselves and each other.